It is now my pleasure to introduce our keynote speaker for the evening, Andy Slavitt. He is no stranger to Minnesota, and that's mainly because he lives here. You may know him best as the former acting administrator of the Centers for Medicare and Medicaid Services. You may know it as CMS. That's a position that he held from March 2015 to January 2017 in the Barack Obama administration. And under his leadership, the U.S. healthcare system saw some dramatic reductions in the numbers of uninsured, national improvements in healthcare quality, and the development of value-based payment models. Prior to his service in the Obama administration, he spent a decade at United Health, providing leadership at its subsidiary Optum. Today, he serves as board chair of the United States of Care, a nonpartisan nonprofit organization dedicated to ensuring that all Americans have access to quality, affordable health care and the public policies that will make that possible. Ladies and gentlemen, please welcome our own fellow Minnesotan, Andy Slavitt.
Dean, thank you. And thank you mostly for not making me follow Melanie. That would not have been good. So first of all, congratulations to all of you, to Dean Finnegan, to the President, to all the rest of you on this remarkable achievement. Listening to the Dean recite this sort of storied history here, truly congratulations are in order, and I hope you congratulate yourselves again before I get going. Now, here's the bad news. I have no idea how long this is going to take, but the good news is it's because I actually wrote it a couple hours ago, so it's fresh. But I've been told that if I get done quickly enough, and you all aren't sick of me, I'll be willing to take some questions if you have them. So that'll be the program. But thank you for your leadership. Thank you for the conscience that you all provide to us as a country, for the vision, for being ahead of us and what our needs are going to be, and mostly for working to get real results. And I think that's important. Now, here's one of my disclaimers. I can't tell you how many times I've been asked to be challenging tonight. So this is, I guess, an apology in advance for those of you who I challenge and said, I didn't come to be challenged. Who told this guy to challenge me tonight? But you asked me here to talk about the future of public health and what the next 10 years might look like. And I thought I better be careful for the following reason. Who among us, if we were asked to talk about the future of health 10 years ago, would have predicted that we would be in the middle of 3 years in a row of a decline in life expectancy? Who 10 years ago would have predicted that nicotine use would be on the rise among teens and kids in their 20s fairly dramatically? Who 10 years ago would have predicted that we'd have continued widening health disparities? And who would have predicted 10 years ago that the suicide rate among 10 to 14-year-olds would have tripled in the last 10 years? So that's what the 10 years before it brought. And so I'm going to be very careful about predicting what the next 10 years are going to look like, because I don't think any of us saw that coming. Now, what I just said in a very Minnesota way is, despite all of our accomplishments, we're not succeeding. And I don't know how many of you would agree or disagree with that, but those are not the kinds of things that we would have liked to hear 10 years ago, and they're certainly not the kind of things that we're going to want to hear 10 years from now. So why are we losing? I also want to make sure that as I answer that question, I talk about public health from the view of the public. And by the public, of course, I mean Twitter. No, not really. I have spent my time on Twitter, I will admit. But I've done it for one reason, and one reason only, and that's to impress my son. My son is completely unimpressible, and I am so shamefully out for his approval, I can't even explain it. I was on the cover of Time magazine, and he said, "What's Time magazine?" So I left the government, and he said, Dad, your days of people following you on Twitter are completely over. And I think I had like 20,000 followers at the time. And I was like, so from there, I'm like, to hell with that, son. So I would literally walk into every time, another 10,000, there's another 10, now I got 100,000, now I got 200. And he's like, okay, Dad, I got it. I give up. But it was actually through Twitter that I got most engaged with the public. It was the summer of 2017, and there had just been a vote to repeal the Affordable Care Act in the House of Representatives. And I came home, and I was talking to my wife, Lana, who's here tonight, and she quoted me a stat that really bothered me. She told me that only 9 people who voted to repeal the ACA were holding town halls with their constituents over the summer break. And that really bothered me. It bothered me almost more than the vote itself, because it felt it was a breakdown in the link of democracy. You know, we're not going to agree with our representatives all the time, but we expect them to represent us. So I got onto Twitter, and I sent a tweet, which turns out the minute you hit the button, it just goes. I didn't realize that. And I said, hey, if you're not holding a town hall for your constituents, why don't you please do that? And if you won't, I'd be happy to come to your district and do one for you. And 3 months later, I'd done 16 town halls, military bases, everywhere from Arizona, Ohio, Alaska, West Virginia, mostly red and purple districts, as you can imagine. And it was fascinating. You know, I walked into the room, and my opening sentence was, look, it doesn't matter whether you voted for President Trump. It doesn't matter whether you voted for Hillary Clinton. It doesn't matter whether you love President Obama or think he's the devil. None of that should have any bearing on your ability to take care of your family if someone gets sick, or to keep them healthy. And I could feel people take an exhale when I say that, because they wanted permission to separate their lives and their health from the politics that have been wrapped around it. But I heard stories from all these folks about their lives, and I will tell you that they feel like they're losing too. They feel like the politicians aren't representing them. They feel like insurance companies aren't helping them. They feel like everybody is doing well except for them. So I think by that measure, I think the public version, I think a public health, if you ask the public, how is our health? I don't think we'd get a very good answer. So if the public is losing, and public health is losing, interesting question, who's winning? Who is winning? Who's been winning over the last decade? And I'll tell you who's been winning. Industrial health. Industrial health. What do I mean by that? I mean, 10 years ago, the healthcare industry was left for dead. It was told that after the ACA, their profits would go away, they wouldn't survive, they wouldn't do well. But fortunately for them, they had a lot of lobbyists. It turns out, when money's involved, they're more adaptable than one would think. Now, look, I know a lot of you represent corporate America. I've been part of corporate America. I'm not here to demonize corporate America. I think almost everybody that works in healthcare is a good person. But I am going to talk about what I think, where I think the power lies and where I think the challenge is, and that is in industrial America right now. In fact, I use the word industry because we make industries in healthcare like they're going out of style. We even made a healthcare technology industry so powerful it has tons of employees, lots of profits, lots of lobbyists, and nobody even likes the healthcare technology. So we can make industries without even focusing on the value we add. That's how good we are in healthcare. We had an ACO industry before anybody knew what it was. So we have this incredible force and dynamic when it comes to the industry of healthcare that's quite different, I think you'd agree, than when we're talking about public healthcare. So if the next generation of public health doesn't begin to eclipse this generation of industrial health, I would put forward that we're all going to lose. We'll all be the poorer for it. But let me talk about the state of industrial health and not where it's all bad, but where they are in their focus right now, just so we have a sense. So I think healthcare executives and healthcare industry generally is focused on the Peloton generation. Anybody see that commercial, by the way? Oh. And look, I will admit, I rode my Peloton this afternoon. I will admit that. I will admit that because someone will call me on that if I don't say it. But that we would admit that that's not where the public health problems are. It's not the Peloton generation or whatever that thing, whatever she was doing, Peloton. She made me very nervous. Apple, but that's, secondly, the hospital systems, the hospitals in our country, they're designed still to cover our acute needs, but not our chronic needs, not our ongoing needs, not our health needs. Pharma industry is doing a phenomenal job of investing in cures, but they don't care if people can afford them. And our safety net is being starved and it's under attack. And we'll talk about that in a little bit. And everybody in the industry is really good at one thing. They're really good at describing the maladies being done to them. They're really good at describing the maladies being done to them, not so good about describing what's happening to their patients. I was with a pharmaceutical CEO of one of the 2 or 3 largest pharma companies backstage before we were both set to go out and speak. I asked him what the number one issue for the pharmaceutical industry is right now. You know what he told me? Tort reform. Tort reform is the number one issue. I said, oh, how about patent reform, by the way? He said, hey, let's be careful we don't get unintended consequences. True story. I'm just relaying it to you. I'm not giving you his name because I'm being polite, but it's a true story. I have other examples, but I'll move on from them so y'all don't get too heated. But let's talk about the state of the industry. If we can't overtake the industry, maybe we can work with the industry in moving our public health agenda. So let's talk about how the industry thinks about public health, since we might agree that's where the power is and that's where a lot of money is. So I'm going to give you a few observations. My first observation is what I call the Big Mac comment. The Big Mac comment. What I mean by that is every single time I give a speech and I take questions, somebody inevitably asks me, Andy, how come I have to pay for the health care for people who eat Big Macs and don't take care of themselves? So there is this sense and this perception that people are in part to blame for the public health issues going on. And by the way, just as a side note, Big Mac put a piece of bread in between 2 burgers. How come no one else figured that out? That just seems like that's such an obvious thing, but 50 years, no one else has done that. Anyway, that's not my point. That's not my point. I just think it's interesting. So I was talking to a hospital CEO who told me a really interesting story. He said, I challenged my team, this is a big hospital system in Ohio, to come up with a community-wide initiative for the coming year. And I said, I'm not going to tell you what it is, but I'd really like it to be childhood obesity. So the team goes away, they come back to him, and they say, we don't have a childhood obesity problem. He said, what are you talking about? All I do is look around, I can see we've got a massive childhood obesity problem. They said, no, we don't have a childhood obesity problem. So of course he says, explain this to me. They say, we don't. No, there's not a childhood obesity problem here. There's a hunger problem. What's happening is kids are not getting school lunch, and after school, they're going and eating salty snacks and sugary snacks, and that's what's happening. And almost like the converted, he was telling the story on himself, on how he learned. He is now the biggest believer. And so they launched an anti-hunger program across the community, not a childhood obesity program. Interesting. One of my favorite questions to ask CEOs when I talk to them is, so do you have a social determinants of health strategy? And what do you think they all say? Oh yeah, I have a social determinants of health strategy. But then when I follow it up with, so do you have a strategy on structural racism and poverty? They look at me like I'm crazy. So we've got this sort of trendy thing people are flirting with. They think they understand. They think it probably has to do with transportation. In fact, I was talking to CEOs on stage together. I was interviewing them both, and one of them very proudly said, you know, we provide free non-emergency transportation to our hospital. And the other CEO looked at him and in a very one-upsman-like way said, that's great, we provide free transportation to church. And I think the point he's making is, depending on how you view your role in the community, socialization, connections, et cetera, maybe you're going to be driving fewer people into the hospital, and I thought that was interesting. Finally, the other anecdote I'll tell you is CEO, very eager, had the bug, social determinants of health, going to make it a big investment, a huge initiative, asked me what I thought. Shouldn't have done that. And I said, why don't you start by doing a survey of your own employees? Turned out disastrous. Turned out ended up having to give a lot of pay raises because there were a lot of people who in the social determinants screen got very bad results. And so my point is this, they're in a state of discovery. People are in a state of discovery about a whole bunch of things that you guys have known forever. You, not only have you known this forever, you believe you've told them this a number of times. And so you're wondering why it's taking them so long to catch on. And so I'm not suggesting that we turn against this whole industrial complex. In fact, I'm not even suggesting we educate them. I'm suggesting we convince them. I'm suggesting we persuade them. So what do I mean by that? What would that look like? So what if within the next 10 years, or ideally sooner, every company in the industry hired a chief public health officer? What if they hired a chief anti-poverty officer? What if they hired a chief anti-hunger officer? What if that was became part of what they felt their responsibility was and what they did? A lot more jobs for the students here, too. But even more challenging, what if in the next decade or sooner, there was a voice for public health in Washington, I'm talking explicitly now about Washington, a lobby, if you will, that was as strong as the vaping lobby, the gun lobby, the fossil fuel lobby. Imagine. So let's talk about changing the game. That's what I want to talk about. Okay, so picture this. It's 2024. We're coming out of a deep recession, which I am not predicting. We have a new president. Y'all missed it. I said 2024. We have a new president. She wants to put forward a $1 trillion stimulus package to boost the economy. Remember the High-Tech Act? So what happens when this occurs? Let's think about it. People are lined up for miles in front of Congress with their ideas, spending their money, using their lobby, with their big ideas, trying to get them in the stimulus bill. So here's the question for you. In a scenario like that, will public health be prepared to get a $100 billion investment in the future of this country? Can we make the case for a $100 billion investment in the future of this country? And for the fiscal hawks among you, I know where you are. Let me just tell you what $100 billion is, to put in in terms. It's 1% increase in the corporate tax rate. So if you recall, the corporate tax rate just went from 34% to 21%. Now, you may not know that their goal was to get it to start at 20%, start the negotiation at 20% and land at 25%. They had no idea they were going to get it all the way down to 21%. So if you took it up from 21% to 22%, that's $100 billion, just so you have some context, because these are big numbers. So what happens then if we don't blow this opportunity? How will we remain ahead if we don't stand up and get the investment that we need and aren't able to make the investment we need in the 10-year outcome is going to be who knows. So let's talk about that a little bit, because as long as, again, fossil fuels, guns, vaping, nicotine, and yes, the healthcare industry control the agenda with no counterweight from you, we lose. So here's my message. Get ready now to compete for that $100 billion. To make the case that we need to reinvest in the future of this country. Okay, so how? So what do you need in order to make the case? You need a vision, you need a constituency, and you need the ability politically to use a triggering event to drive public consciousness to get the country to focus on those investments. Now, I can't tell you that vision. I think the vision sits with all of you. But I will tell you what I would do a little bit. First of all, constituencies are everywhere. What do I mean by that? There are 18 million Americans in families right now that have lost someone to suicide, to addiction, or to the streets. 18 million Americans, a powerful political force if someone mobilized them. Now, no one has. But there are constituents everywhere you look around this country to fight for these kinds of things. There's triggering events everywhere. The opioid crisis, maternal mortality crisis. These are events that can capture the imagination of the public. The insulin crisis. Now, the dean was right. In 1990, we got close to $30 billion out of Congress. But we got the money in 1990. Next time, let's get that money in 1980. Okay? I mean, this is what we're talking about. So what are the core elements that will capture the attention of the public that might go in to how we would use $100 billion? Let's start with this. It's a system that includes everybody. It's a system that includes everybody, where everybody in this country can afford their health. That's not too much to ask. We're having a conversation with one of the former prime ministers of Australia. And I like to compare us to Australia in case you ever need to compare us to a country, because when you say some European country, people don't think they're tough enough. They're just a little too socialist for us. But the Australians they're swashbuckling people like us. They're frontiers people, right? And there's snakes in Australia, deserts in Australia. And he said to me, look, we love you Americans. We have a lot in common with you. But the one thing we don't understand, one thing that makes you different, is you seem to have a philosophy of keeping your citizens in a state of quiet desperation. And I thought about that, and what I think he was saying is, for most people in this country, they don't really know if the worst happened, they need an expensive drug, if they had cancer, something terrible happened, whether they'd really be able to afford to take care of their families. And that's an existential crisis for people. That's a threat to people. And he said, look, we don't do everything, but we at least try to take the basics off the table. So for one, I think that might be a good place to start. Secondly, you might want to elevate and with all apologies to clinicians, a really significant non-clinician workforce in this country that can provide culturally competent, local, connected care, maybe supported by technology around the country. You might want to create a school workforce to help and educate our kids and provide social work and mental health care. You might want to invest, not like everybody talks about in the last year of people's lives, but what about the first year of people's lives? What if we invested in the first year of people's lives? How about affordable housing? How about affordable housing without leaks? How about affordable housing where people repair things when they break? Functioning utilities. How about a new mental health infrastructure, not just for our teens, but for our country? How about investing in connectedness? How about trauma counseling? You could spend $100 billion in a pretty fruitful way. And I encourage us to start to articulate what a plan might look like. You know, I was at the drugstore about 2 weeks ago, picking up a prescription at Walgreens near my house. This is not a great story. I mean, you're not going to laugh, put it that way. And there was someone next to me getting a prescription, and he had a Jerry's grocery badge on, and I recognized him as a bagger. He was someone, I don't know if he was developmentally disabled or he had some challenges. I didn't know what they were. And he asked for his prescription, and the clerk went and got the prescription, and she came back, and I will admit, snooping as I was, I didn't know what the name of the drug was. I Googled it, and it was for bipolar disorder and schizophrenia. And she came back to him and she said, "Good news, we have all 3 of your drugs ready." And he said, "No, I only have the money for the one." And I stood there about as helpless and stupid as I felt in a long time, because a part of me wanted to, I assumed that these are something for help him with side effects, and I just couldn't imagine him walking out of the store without them. Another part of me felt like, Slavitt, mind your own goddamn business. And then, of course, the greater part of me said, you know, this happened probably the hour before, and it'll happen the hour after I leave in every pharmacy in America. So that's kind of where we are. And what does next year look like? Next year, 3.7 million people are going to get kicked off SNAP. 1 million kids are going to lose their school lunches. So we're starting off the next 10 years. That's the direction that we're starting off with. So yesterday I was in Boston giving a speech to a mixed crowd. And by mixed, of course, I mean white pharmaceutical CEOs and white insurance company CEOs. And I did get the Big Mac question. I will say. But I was actually asked a very interesting question. It was, okay, smart guy, if you were president and you could do one thing, what would you do to fix the healthcare system? And I said, electoral reform. I said, what? I said, when we have a more representative democracy, we will have the healthcare system that we need and deserve. When voters are more important than money. And what do I mean? I mean voting rights, I mean the Electoral College, I mean gerrymandering, I mean ranked choice voting, I mean all of it. And by the way, a little corruption bill wouldn't hurt as well. We've left a few loopholes there, apparently. So what's the vision for the future? I guess the vision for the future depends on the future graduates of the school. I actually think it depends on your financial commitment to this school. I think it depends on whether or not the people who graduate from the school choose to pursue $100,000 grants or $100 billion ideas for this country. I really do. And I think we need a school like this that's pushing them in that direction. I'm going to go back to what the dean said earlier. We know we can do this. We cut the smoking rate in half in this country when no one thought it could be done. As HIV has continued to grow, we've cut the death rates by 75%. We can do it. And we're starting to perhaps maybe not repeat some of the same mistakes. I saw this statistic today that will surprise none of you, but I thought it was pretty dramatic. In the 90s, crack epidemic. You know that crack is more used by whites than African Americans in the 90s and is today. The arrest rate was 13 times African Americans to whites in the 90s. So we have a more compassionate reaction to the opioid crisis. We're not thinking about people as criminals. We're understanding things as chronic disease. And it's disturbing how much race has driven that thinking. But nevertheless, we are getting smarter about understanding and not blaming people as we had in the past. So, you know, as I finish up, the note of hope for me is compassion. It's instead of talking about public health solely, it's really talking about the connectedness and the compassion that we need in our country and our society, and I think people react to that. And you all who are so well known for your thought leadership, I would suggest to you, and I'll take this advice myself, that in addition to being great thought leaders, you need to be more warriors. And you need to be more marketers. Because you have told people for a long time. And it's maybe not that they didn't listen, but maybe we didn't tell them well enough, or long enough. So PBS programs. Next time you write a great paper, don't leave it in the journal. Go figure out how to go persuade people. And as you do it, continue to provide the compassionate leadership that you provided, and makes me so proud to be here in Minnesota with you all. So thank you.
So for the students in the room, or recent graduates, young professionals, who don't necessarily have a position of power or influence yet in their early careers, do you have any specific advice for us on how to achieve this $100 billion investment in 4 years?
I mean, for the students in the room, you will have that power more quickly than you think. You will be where some of the people you admire are more quickly than you think. And so a lot of it is all about what you do between here and there. And so I would worry more about your passion area and what you think is right and your commitment to that and becoming as excellent at that as you can be, and then building coalitions around that, and people will swim to that. Today, we do live in a country where ideas can move very fast, coalition building can happen very quickly, and power happens very differently than when a lot of us were growing up, and people aren't waiting any longer. So I'd say just learn forever, and be a warrior. Be a warrior for what you believe in.
Got one over here.
Do you believe any of this is going to change if illness and disease continue to be a profit-making enterprise?
I thought you were going to ask me about the Big Mac. So here's the thing. I really believe that part of our path is innovation in this country. I'm not up here to demonize, I'm up here to demonize rent taking and I'm up here to demonize lax rules, and I'm up here to demonize people who game the system, and I'm up here to demonize people who don't provide the cultural leadership to make us a healthier country. But not to demonize a sector, not to sweep a broad brush and say that capital, for example, can't be a productive tool to helping solve some of these problems. It can, it absolutely can, but not pooled the way it's currently pooled, not in the current condition that it is. And yes, I do have some problems with some of the places where we were focusing on profit. But it's not just that, because whether you're for-profit or non-for-profit, you've got the same issue, which is people in healthcare obsess over revenue and market share. People in general obsess over revenue because it's more fun than obsessing over costs. So you're creating a system where you don't have to think as much about revenue. You've got a all-payer system, or you've got some form of capitation. You've got something where your challenge as you wake up every day and lead an organization is how to manage costs and how to manage quality and how to manage and improve. And I think the profit motive does get in the way, but there is also probably a way it can be useful for us.
So one thing that's really been kind of taking off lately is personalized medicine. So you've talked about industrialized health, and one of the things that a lot of organizations are doing now are trying to figure out fixes for each individual rather than going into populations. Or you can get your specialty vitamins or things to kind of fix those kind of individualized states. What are your thoughts on that in terms of the future?
You know, I think people mean different things when they say personalized medicine. I think, life sciences, that means developing therapies that are unique to our individual genes. It's great. We're the wealthiest country in the world. We can afford to do that. We should be doing that. There is a future where we're doing a lot less cutting of people and a lot more prevention and a lot more testing and so forth. But I think there's another way you mean it too, which is, at some level, we have to stop treating everybody like the average patient. I don't care about how people do on average. I want to start talking about how is the bottom quartile doing, and what's the gap between the bottom quartile and the top quartile. And then, instead of talking about how do you get people to engage in their health, what about instead finding people that people trust, whether they're clinical people or non-clinical people, and using that to connect people back to the healthcare system, because people are very disconnected. And finally, we know this because the data says this, that if someone has a regular source of care for 4 years in a row, their costs go down and their outcomes improve. And so that ought to be our goal. And that could be different for everybody, as you say. My version and your version can all be different, but that's what we have to ultimately strive for.
Ladies and gentlemen, let's thank Andy Slavitt for this evening. Andy, thank you.